Chronic lymphoblastic leukemia, or CLL, is a type of cancer that primarily affects older adults. It affects the blood and bone marrow, disrupting normal cell production. CLL involves a specific type of white blood cell, the lymphocyte, which plays a crucial role in our immune system. Lymphocytes are an important part of our immune system, helping to defend the body against infections and diseases. They help fight off infections by targeting and destroying harmful pathogens. In CLL, these lymphocytes grow abnormally and do not function properly. They accumulate in the blood, bone marrow, and lymph nodes, leading to a range of health issues. This buildup interferes with the production of healthy blood cells, which are essential for normal body functions. CLL is a slow-growing cancer, meaning it progresses gradually over time. Many people live for years with it, often without significant symptoms. They may not even experience symptoms in the early stages, making regular checkups important. However, as the disease progresses, it can lead to various health complications, including infections and anemia. Understanding the causes, symptoms, and treatment options for CLL is crucial for early detection and effective management, improving quality of life for patients. The exact cause of CLL remains unknown. Research suggests a combination of genetic and environmental factors may play a role. Family history of CLL or other blood cancers increases the risk. Exposure to certain chemicals and pesticides has been linked to CLL development. However, more research is needed to confirm these associations. Age is a significant risk factor for CLL. Most cases occur in people over 60. Men are slightly more prone to developing CLL than women. While we don't fully understand what triggers CLL, ongoing research aims to identify specific risk factors. This will pave the way for better prevention and treatment strategies. Many people with chronic lymphocytic leukemia, or CLL, experience no symptoms in the early stages of the disease. As the disease progresses, symptoms may gradually appear, often going unnoticed at first. One common symptom is swollen lymph nodes, which can be an early indicator. These swollen nodes can be felt as painless lumps in areas such as the neck, armpits, or groin. Fatigue is another frequent complaint among those with CLL, often impacting daily activities. This fatigue is often accompanied by a general sense of weakness and shortness of breath, making even simple tasks difficult. Some people with CLL experience frequent infections, which can be severe and recurrent. This is because the abnormal lymphocytes in CLL can't fight infections effectively, compromising the immune system. Unexplained weight loss, night sweats, and easy bruising or bleeding are other possible symptoms that may arise. It's important to remember that these symptoms can also indicate other health conditions, not just CLL. If you experience any of these symptoms, it's crucial to consult your doctor for a proper diagnosis and appropriate treatment plan. Section 4. Diagnosis of CLL tests and procedures. In this section, we will explore the various tests and procedures used to diagnose chronic lymphocytic leukemia, or CLL. Diagnosing CLL typically involves a combination of tests and procedures. These tests help doctors understand the nature and extent of the disease. A complete blood count, or CBC, is usually the first step. This test is essential for providing a snapshot of your overall health. This test measures the number of different blood cells in a blood sample. It helps in identifying any abnormalities in the blood cells. If the CBC shows abnormalities, a bone marrow biopsy may be performed. This procedure is more detailed and provides additional information. This involves taking a small sample of bone marrow to examine under a microscope. The sample helps in understanding the cellular makeup of the bone marrow. Flow cytometry is another important test for diagnosing CLL. This advanced test provides detailed information about the types of cells present. It identifies and quantifies different types of cells in a blood or bone marrow sample. This helps in determining the specific characteristics of the leukemia cells. Genetic testing may also be done to determine the specific type of CLL and guide treatment decisions. This test can reveal genetic mutations that may influence treatment options. Early diagnosis of CLL is crucial for improving treatment outcomes. The sooner CLL is detected, the better the chances of managing the disease effectively. If you have any concerns, don't hesitate to discuss them with your healthcare provider. Open communication with your doctor is key to receiving the best care possible. Section 5. Treatment options, a multifaceted approach. Treatment for CLL depends on several factors. This includes the stage of the disease, the patient's overall health, and their preferences. In early-stage CLL, watchful waiting may be recommended. This involves close monitoring without immediate treatment. For more advanced CLL, various treatment options are available. Chemotherapy uses drugs to kill cancer cells. It can be administered intravenously or orally. Targeted therapy uses drugs that specifically target the abnormal lymphocytes. Immunotherapy helps boost the body's immune system to fight cancer cells. Stem cell transplantation may be an option for some patients. This involves replacing damaged bone marrow with healthy stem cells. UMCC, your ultimate medical consultants connector.